Dr. Denise Ejo, the CEO of Cornwall Cancer Foundation. I would like to welcome you to our Cornwall Cancer Foundation page. Our goal is to create an awareness of the challenges, support and guidance experienced in managing cancer care for sufferers, family, carers and friends. To engage with us, don't forget to subscribe to our channel. Click our notification bell.
We will be analyzing these issues. Over to you, Dr. Ejo.
Joining us this morning as we talk about cancer. Welcome to our Kakaki edition of the Cancer Awareness Campaign in partnership with AIT. Good morning and thank you all for joining us. This is Cornwall Cancer Foundation. My name is Dr. Denise Ejo. So, good morning, doctor.
Morning. Can you hear me?
I can hear you. Can you hear me?
Excellent.
Fantastic. Welcome. All right. Good morning. Let's kick it on now. Are you good? Let's enjoy ourselves. Let's have a nice conversation. Our guest today in the house is Dr. Elibte, Dr. Dupe. Doc, how do you want me to refer to you throughout this conversation? Because I always tell them I know you. You want me to just call you Doctor? Sorry?
Sorry, I can't hear you that well.
Okay, I'm glad you said that. It will be resolved very, very quickly, so don't worry. Can you hear me now? Can you hear me?
I can hear you now. Yes. Sorry, you were asking me.
I said, are you ready for us to keep this conversation or not?
Totally. Absolutely. Thank you very much for having me.
Thank you. Thank you for joining us and thank you for your time. So I'm going to quickly introduce Dr. Elibte to you. Dr. Elibte is qualified in medicine from Lagos University, who qualified from Lagos University in 1986 and subsequently underwent postgraduate training in internal medicine and hemato-oncology. I'm very mindful with my words, Doc. You will most probably recognize that because I don't pronounce words very easily. She was awarded a prestigious research fellowship by the Leukemia Research Fund and through her groundbreaking work obtained a Doctor of Medicine from the University of London. Having worked for over 30 years in several excellent centres in London, including the Royal Marsden, St. George's and King's College Hospitals, she's returned to Nigeria to set up the Marcelo Ruth Cancer Centre and Specialist Hospital in Lagos. Dr. Dunsi is a committed clinician, passionate teacher, a researcher, and is married with 3 children and a grandchild. Welcome to this day, to this program. Today we will be talking about the role of the hematologist in looking after cancer patients. Did I pronounce that word properly? Because I am very factual about it. Did I get it? Hematologist, right?
It's hematologist, like hematologist, yes. Well, thank you very much, Doctor. Yes, hematologist, yes. Yes. Thank you very much for that very kind introduction.
You're welcome. I was trying to just make sure I get these words right because I'm not a medic, and I'm very quick to recognize that. So let's keep this conversation going. What or who is a hematologist?
So a hematologist is, as you just rightly described, a doctor, a medical doctor who then specializes in looking after patients with blood conditions, blood disorders. And in terms of hematology, our role is dual. So one is in terms of looking at the laboratory or getting involved with laboratory blood tests, how to interpret blood tests, and how to use that information to either make a diagnosis in a patient or how to monitor them when they are being treated. But also, clinical hematologists are responsible for looking after our own patients. And it ranges from patients with anemia to patients with inherited blood disorders. So, for example, in this part of the world, we have a high incidence of sickle cell anemia. And then on the other side of the spectrum, looking after patients with blood cancers, so patients with leukemias, lymphomas, that sort of thing. So quite a wide spectrum of involvement, really.
Yeah, that's interesting, because when a lot of people don't really know what you do. We all go for this blood test very regularly, and we have this conversation about this blood test, but we really just don't know who you are. We're just going for a blood test, and then we start listening to your conversations and find, oh no, this person is not what we really thought they actually did. So when do we need a hematologist as an ordinary? So because we're talking to everybody like me, although I live with the disease, I don't know anything about what you guys do. So I'm going to keep going on from that perspective. All of us, we don't know what you do. So when do we need a hematologist?
So actually, a lot of people don't even probably realize that a hematologist is involved in their care as early as we are, because when you just go for a blood test, patients don't know what that necessarily means. Typically, a patient will access hematology or blood test because they're feeling really tired all the time. Patients who are bleeding, patients who have fevers or night sweats, patients who have unexplained lumps somewhere, and patients who have unexplained weight loss as well. So anybody who actually goes to a laboratory, either a diagnostic center or a hospital for a blood test, now that result will be looked at by a number of people, including a hematologist. And then the hematologist is there to say, well, this is actually normal. Or, for example, this young lady, for example, has anemia, and then the question is, why does she have anemia? And of course, in women, the commonest reason is because they have high, heavy periods, so they're, losing iron, so iron deficiency anemia because of heavy periods or due to dietary deficiency. So that's when patients, they probably don't know they need a hematologist when they already do. But we pick up the results from the lab, and then we'll contact either the doctor who sends the bloods or the patient if they went to the laboratory themselves to discuss these results and then to give advice about what to happen next.
Mm-hmm. I'm always thinking, because I'm not a medic, so I like to be always very careful with what I say. Okay, so but no, let me go back. I'm going to come back to you on another question. So additionally, based on what you're saying to me now, the hematologists are responsible for the care of patients with blood cancers, right? Or rather, blood cancers. Let's keep it in that context. So it's the leukemia, it's the lymphoma, it's the myeloma, and generally everyday general treatments of diseases.
Yes, and anemias, yeah.
Yeah, okay, because your words are very tongue twisting, so I have to be very honest with myself. Now, let's go. So, treatment for all these patients can be quite complex, and that I picked up from conversations with you, and may require the need for stem cell transplantations to achieve a cure in these patients. So, can you guide us, firstly, on what all the way, okay, let me put it this way, all the way to the stem cells and all that, because I won't even have a clue what you're trying to say. And I don't want to ask the wrong question or complicate it. So I'm going to ask you more questions from there. Go on.
Okay, so, I think, first of all, I just want to reiterate the point that, the patients we look after are quite broad. So when we're looking after patients with anemia, simple anemias, iron deficiencies, those are very easily treated. It's more making the diagnosis and then giving the patient the advice to maybe take iron tablets. Sometimes some of them may need surgery, so they need to see a gynecologist. So we have, not everything we do that's quite complex. We also are looking after quite straightforward conditions as well. And when it comes to sickle cell or cancers, which are the conditions which you look after that may require quite intensive treatments. This is because what we're trying to do in those patients, be it this inherited blood condition, sickle cell, for example, or thalassemias, or an acquired blood cancer, like leukemia and lymphoma that just occurs suddenly in most cases, the end game is to try and bring that bone marrow. The bone marrow is the factory that makes all our blood cells. So we have three main types of blood cells: red blood cells, white blood cells, and platelets. Most people know about red blood cells. They protect us from, they help us carry oxygen around the body. People know about white blood cells. They help us fight infections. And platelets are little blood cells that stop us from bleeding. So the bone marrow produces all these cells. And if the bone marrow is not working well, either because of this inherited blood condition or an acquired condition like in cancer, leukemia, lymphoma, ultimately we want to try and get that person's bone marrow back to normal. So initially we might have to use chemotherapy, at least in the case of cancer patients, to clear the bone marrow and make it, you take away the abnormal cells, the immature blood cells called blasts or leukemia cells. We need to remove them first. And when the patient is in remission, then the stem cell transplant is an attempt to keep them in remission, okay, for the long term. And stem cell transplantation, again, is twofold. One is where you take the stem cells from the patient themselves. You then give them high-dose chemotherapy, and then you give them their cells back to rescue them, and then hopefully correct their bone marrow back to normal. Or what we call allogeneic bone marrow transplants or stem cell transplants, where you have the patient and then you have the donor who is donating their stem cells to the patient. And again, you give the patient chemotherapy to wipe out all these abnormal blood cells that they have. And then from the donor, who maybe most likely, the best donor is somebody who is related to the patient, particularly a sibling, a brother or a sister. And we collect the stem cells from the brother or sister, and then basically we transfuse it into the patient. People sort of think that stem cell transplants are similar to organ transplants, where it requires surgery, and that's not the case. It's actually giving like a blood transfusion. But it's not a simple process. It's quite complex. It requires high doses of chemotherapy before. It requires taking medicines afterwards that will stop the patient from actually trying to get rid of the cells. But at the time of the transplant, it's like a blood transfusion. That's how stem cell transplants are done in a nutshell, some sort of simplified. But like I said, the aim is to make sure the bone marrow is normal.
Okay, so I'm now going back to, I most probably would have said something about it, but I have to make sure I get it. Like I say, it was the general public, and I stand as one of those that don't get won't get science. I'm not a science person. So now let's bring it back to cancer and chemo. Because I've come to realize now that a lot of people run away from cancer treatment because of this chemo. And a lot of your work, we can't do anything, or rather any treatment a cancer patient has to have. You are the center, you are the start, you are even the end, because we have to get the blood first before it goes through. So how does this work? So when you're doing this, your testing as a hematologist and undertaking chemo, another disease, how does it work to make sure that patients, because patients are anxious, as you would appreciate. Cancer patients are very anxious about almost everything, and we are permanently having our blood taken, permanently. It's taken for this, it's taken for that, it's taken for that. But really, there are lots of other things you do. So why do you do so much testing, and how, is there any easier way other than having the pot or the other one? Anyway, you know the ones you guys use. So I'll throw it at you. You understand what I'm talking about. So I'm giving.
I understand exactly. I understand exactly what you're saying, and also I understand particularly clearly about the anxiety, because just like you're saying, and you're a doctor yourself. I know you're a PhD doctor, but you're a highly intelligent lady, and so a lot of these conditions have complex names. Typically when a patient is even diagnosed, they've never heard of the condition before. I've had the 32-year-old gentleman that we're treating at the moment for acute myeloid leukemia. I mean, he works in a bank. In all his life, he didn't do biology. You know what I'm trying to say? So that is part of the problem. Patients would never ever have heard of these conditions before. They have no idea what it means. The relatives are even more in the dark. So we have to spend a lot of time discussing diagnosis and explaining to patients to try and remove some of the anxieties. Excuse me. Now, when it comes to the testing, blood tests, testing in the beginning is to help make an accurate diagnosis. And that's for both hematology type cancers, but as well as solid tumors, like in breast cancer or lung cancer or anything, because now we know that we can provide more targeted treatments or more individualized treatments for patients. And if we know exactly what is going on with them, and in particular, if we know if they had inherited any, not inherited, sorry, they have an acquired genetic problem that has now caused that cancer. So in those cases, that's why we do the blood test at the beginning. Later on, we do the blood test because we're trying to monitor treatments. You've already referred to it. So a patient who is on chemotherapy, the chemotherapy, chemical therapy, that's what it is, can bring the blood cells down. Also, these drugs need to be excreted through the kidneys or the liver. So we're constantly testing to ensure that the liver or the kidney is not being affected so much. And if it is, then that may be an indication for stopping treatment or for reducing the dose. So that's why it's important that we're constantly testing the bloods throughout. So that's why patients have to have blood tests, because they're constantly having to monitor what they're doing, what the bloods are doing. I think there's a gentleman online.
Yeah, that's
what sort of here in the background.
Yeah, I don't know who it is. Okay, let's go. The next one is the haematologist. You oversee laboratory aspects of patient's care, which are required to make a diagnosis. Yeah, and determine whether the patient is out there. And I think sorry, I think that's a doctor. Please, can you mute your mic, please, sir? Okay, go on. So, go on. Okay, so should I continue? Dr. Dupe, can you hear?
I can hear you.
You can?
Hear you now, yes.
All right, fantastic. Okay, so what I'm going to do now is I've got one more question for you. In Nigeria, then this, me, I'm always about this Nigeria thing. In anything we do, we always have to have signs, and we get signs. And can you give us 3 that we all need to know to start recognizing alarm bells might be going off, and we need to quickly address what we're going through.
Yeah. So feeling very tired all the time, in particular, if you're feeling so tired that you're not able to do your normal duties, where it's like getting out of bed in the morning is tough, and sort of getting on with your daily duties is a problem. So that kind of tiredness, as I said, unexplained weight loss, where you're not actively on a diet and the weight just seems to be coming off, that's a real warning sign. A lump anywhere in the body, be it the breast, anywhere, any lump that occurs that is still there after 2-3 weeks and you really can't explain it, unexplained bleeding from anywhere, And I know you only asked for 3, but I'm just trying to make sure.
Go on. It's quite good, yeah.
Yeah. And sweats, night sweats, in particular, what we call drenching night sweats, where you have to wake up in the middle of night to change your clothes. And of course, women who are going through menopause sometimes have drenching night sweats. So some of it may be easily explained, but if there's any of these symptoms that you get that persists, and also you're not, you're in your 20s and you're getting drenching night sweats, and especially and weight loss and a lump, and any discharge that comes from the lump, any unexplained bleeding, be it vaginal, be it in your urine, be it in your stool, be it coughing up blood, anything like that. And as I said, unexplained tiredness, all those things are it's very important that people shouldn't stay at home with those sort of symptoms or signs for too long, and they should access healthcare.
Dr. Odunsi, I want to say a very, very big thank you to you for actually giving us this, and we will take the clips and we will take the points, and which is very key, because those signs of tiredness, just when you're not feeling well and you can't point to what you need to do, as Dr. Odunsi said to us all, we need to go and find out what it is. And the haematologists are the ones that actually do the investigations. Let me try to use the right lingo here. The investigations that that are required for us to be able to know that if there is something wrong, because that is their fundamental role, and it's very key. A lot of us as cancer patients, we do not realize, but they are the heart of exactly how our treatments are planned. So I want to say a very big thank you to you, Dr. Duque. I really appreciate you. See, I've called you all your names because I know you personally. I'm trying to be formal. What's going wrong? It's just messing up for me, but yeah. I want to say big thank you. It's all going to come online, and we will be expecting to see you again in the very near future, where we can actually talk about a lot of the things that are very important. I want to say a very big thank you, and to all our viewers, where Dr. Odunsi has explained all the things we need to know and how we need to navigate these things. So to get videos and watch and find out what's going on, follow us on the Cornwall Cancer Foundation. You can find us on our website, and you can also, it's the same name for our Instagram page, our Facebook page, our LinkedIn page. The only difference is on our YouTube page, you've got NG at the end. So we look forward to seeing you again, and we look forward to seeing you, Dr. Odunsi, once again, very soon, in the very near future. Thank you from all of us, the viewers, AIT. We appreciate you, AIT, every day, every time. You're always there for us, always doing this for us. We really appreciate everybody. Doctor, anything you want to say?
Thank you, guys.
All right, thank you so much, Dr. Dennis, a haematologist in Korea. I heard that they